Hello everyone, welcome back to Calwain Health TV. I'm Mr. Calwain, and today we're diving into a critical topic, 7 eye diseases you should know about. We'll talk about the symptoms, the causes, and the treatments. If you find this video helpful, please like, share, and subscribe to our channel. Also, check the description box below for more information and product recommendations. Let's get started. Let's start with a very common eye condition, especially as we age: cataracts. Imagine looking through a foggy window. That's what it's like when you have cataracts. This clouding happens when the natural lens inside your eye, which is normally clear, becomes cloudy or opaque. It's often a natural part of aging. As we get older, the proteins in the lens can clump together, leading to cataracts. It's like how a clear stream can become muddled over time. Cataracts usually develop slowly and can affect one or both eyes. You might not even notice them at first, but over time, your vision can become increasingly blurry. It's like someone slowly turning down the lights on your life. Difficulty seeing at night is a common sign. Have you noticed that headlights seem extra bright or that there are halos around them? That could be a sign of cataracts. You might also experience double vision, faded colors, or a need for brighter light when reading. The good news is that cataracts are treatable. In the early stages, stronger glasses or brighter lighting might be enough to help. But if cataracts significantly interfere with your daily life, surgery is a safe and effective option. Cataract surgery involves removing the clouded lens and replacing it with an artificial one, restoring clear vision. Regular eye exams are crucial, especially as you age. Now, let's talk about another serious eye condition called glaucoma. It's often referred to as the silent thief of sight because it can develop gradually without any noticeable symptoms in its early stages. Glaucoma is a group of eye conditions that damage the optic nerve, which connects your eye to your brain. This damage is often caused by increased pressure inside the eye, known as intraocular pressure. Imagine a hose with too much water pressure. It can cause damage over time. The most common type of glaucoma is open-angle glaucoma, which develops slowly and painlessly. Because there are often no early warning signs, it's crucial to have regular eye exams, especially if you have risk factors such as family history, diabetes, or high blood pressure. Another type is angle closure glaucoma, which is less common but more urgent. It occurs when the drainage angle in the eye becomes blocked, causing a sudden and painful increase in eye pressure. Symptoms can include severe eye pain, nausea, vomiting, blurred vision, and halos around lights. Angle closure glaucoma is a medical emergency that requires immediate attention to prevent vision loss. If diagnosed early, glaucoma can often be managed with medications or laser therapy to lower eye pressure and prevent further damage to the optic nerve. Don't wait for symptoms to appear. Schedule regular eye exams. Let's move on to age-related macular degeneration, or AMD, a leading cause of vision loss in people over 50. AMD affects the macula, which is the central part of the retina responsible for sharp central vision. Think of the macula as the bullseye of your eye's target. There are 2 main types of AMD: dry AMD and wet AMD. Dry AMD is more common and less severe, characterized by the slow breakdown of cells in the macula. Wet AMD, on the other hand, is less common but more serious. It occurs when abnormal blood vessels grow under the macula, leaking fluid and blood, which can cause rapid vision loss. The early stages of dry AMD may not have noticeable symptoms. However, as it progresses, you might notice blurry areas in your central vision or difficulty distinguishing between colors. Wet AMD often causes more noticeable symptoms, such as straight lines appearing wavy or distorted. You might also experience a blank spot in your central vision. While there's no cure for AMD, early detection and treatment can help slow its progression and preserve your vision. Treatment for dry AMD typically focuses on lifestyle modifications, such as quitting smoking, eating a healthy diet rich in antioxidants, and protecting your eyes from harmful UV rays. Wet AMD is often treated with injections of medications that inhibit the growth of abnormal blood vessels and reduce fluid leakage in the macula. Maintaining regular eye exams, especially as you age, is essential for early detection and management of AMD. Diabetic retinopathy affects the blood vessels in the retina. High blood sugar can damage these vessels, leading to vision problems. Early stages might not show symptoms. Later, you may notice floaters, blurry vision, or difficulty seeing at night. Diabetic retinopathy progresses from mild to severe. Non-proliferative stage involves weak, leaking vessels. Proliferative stage sees abnormal vessel growth. Manage blood sugar with diet, exercise, and medication. Regular eye exams are essential. Early detection reduces vision loss risk. Laser surgery may shrink abnormal vessels. Let's now discuss a serious eye condition that requires immediate medical attention: retinal detachment. The retina is like the wallpaper at the back of your eye, and it's responsible for sensing light and sending images to your brain. Retinal detachment occurs when the retina pulls away from its supporting tissues, like wallpaper peeling off a wall. Imagine a piece of tape holding a piece of paper to a wall. If the tape loses its grip, the paper will fall off. This condition is often painless, but it can cause noticeable symptoms, including the sudden appearance of floaters, small specks or cobwebs that drift across your field of vision, flashes of light, especially in your peripheral vision, or a shadow or curtain-like effect that obstructs part of your vision. Retinal detachment is a medical emergency that requires prompt treatment to prevent permanent vision loss. The sooner you seek medical attention, the better the chances of preserving your vision. Several factors can increase your risk of retinal detachment, including aging, nearsightedness, myopia, previous eye surgery, and family history of retinal detachment. If you experience any symptoms of retinal detachment, see an eye doctor immediately. Treatment for retinal detachment usually involves surgery to reattach the retina. The type of surgery depends on the severity and location of the detachment. Laser surgery can be used to create small burns around the tear, sealing the retina back in place. Early detection and treatment are crucial for the best possible outcome. Let's talk about a common but often overlooked eye condition: dry eye syndrome. Our eyes need a constant film of tears to stay healthy and comfortable. Tears not only lubricate the eye's surface but also help wash away dust and debris, prevent infections, and provide clear vision. Dry eye syndrome occurs when your eyes don't produce enough tears or when the tears evaporate too quickly, leaving your eyes feeling dry, irritated, and uncomfortable. Several factors can contribute to dry eye, including aging, hormonal changes, environmental factors like dry air or wind, prolonged screen time, certain medications, and medical conditions like autoimmune diseases. The symptoms of dry eye can vary from person to person, but common signs include a gritty or sandy sensation in your eyes, a burning or stinging sensation, redness, blurred vision, especially after reading or using a computer for extended periods, sensitivity to light, a feeling of something in your eye, and ironically, excessive watering of the eyes, which is the body's way of overcompensating for the lack of lubrication. While dry eye may seem like a minor annoyance, it can significantly impact your quality of life, making it difficult to perform everyday tasks like reading, driving, or using a computer. The good news is that dry eye can be effectively managed with various treatments, ranging from simple lifestyle modifications to prescription medications. If you experience symptoms of dry eye, see an eye doctor to determine the underlying cause and receive appropriate treatment. Let's wrap up with a very common and often contagious eye condition: conjunctivitis, commonly known as pink eye. Conjunctivitis is an inflammation or infection of the conjunctiva, the transparent membrane that lines the inside of your eyelid and covers the white part of your eyeball. Conjunctivitis can be caused by viruses, bacteria, allergens, or irritants. Viral conjunctivitis is highly contagious and often spreads through contact with contaminated hands, surfaces, or respiratory droplets. Bacterial conjunctivitis is also contagious and can spread through similar means. Allergic conjunctivitis, on the other hand, is not contagious and is triggered by allergens such as pollen, dust mites, or pet dander. The symptoms of conjunctivitis can vary depending on the cause, but common signs include redness in the white of the eye or inner eyelid, increased tearing, a sticky discharge from the eye, which may be clear, white, yellow, or green, itchy eyes, a gritty feeling in the eye, and sensitivity to light. Treatment for conjunctivitis depends on the underlying cause. Viral conjunctivitis often resolves on its own within a few days to a week, and treatment focuses on relieving symptoms, such as using artificial tears and cool compresses. Bacterial conjunctivitis is typically treated with antibiotic eye drops or ointments. To prevent the spread of contagious conjunctivitis, practice good hygiene, including washing your hands frequently with soap and water, avoiding touching your eyes, and not sharing personal items like towels, washcloths, or eye makeup. That's a wrap on the 7 eye diseases you should know about. Regular eye exams and prompt attention to any changes in your vision are key to maintaining healthy eyes. Thank you for watching. If you found this video informative, don't forget to like, share, and subscribe to Calwain Health TV. Check the description box below for more resources and product recommendations. Take care of your eyes and see you next time.